My focus is on sports medicine, and particularly on knee and shoulder injuries and surgeries. And so that, even though we say it's sports medicine, what that covers really are most acute and many chronic injuries to the knee and shoulder. One of the benefits of taking care of professional athletes, I think there's two aspects to it. One is just the day-to-day care of those professional athletes really keeps us at a very sharp level in terms of what we're doing. And two, I think being involved in that community and in that level of care gives us, again, access to information and awareness in terms of what's going on that, again, we can bring back to the weekend warrior, to the high school athlete, and hopefully elevate their level of care as well. You know, these injuries happen to everybody. It can be somebody stepping off a curb or getting hit by a bicycle in Forest Park, and we really enjoy seeing everybody from all walks of life. In terms of focusing in on orthopedic surgery, again, you look at the facilities, you look at the Orthopedic Center in Chesterfield, in terms of how patients come into the building, how they're directed, how they find their way to their physician's offices, to their x-ray site, to their MRI, to the operating room. It's laid out well in terms of flow. And then it's laid out in a way that's friendly, that's easy, that's comfortable. And that, I think, helps the patient experience, it helps the surgeon experience, and then you put that in combination with excellent physicians and staff, and it's really an outstanding place to get orthopedic medical care. Often surgery is the easier part of it. The more difficult part of it is you have some discomfort after most surgeries, and then you have to go through physical therapy in most cases following orthopedic and particularly sports medicine surgeries. So I think you need to prepare people for what's involved. You need to reassure them in terms of what's involved. You give them time to think about it. You give them time to ask questions. And if you do that in an informative, thorough way, most people are reassured, feel comfortable about what they're doing, and can make a good decision about what they want to do. So I think one of the greatest things is a little note I got from an 8-year-old girl who sent me a hand-drawn note with crayon saying, "Thanks for getting my daddy better."